All right, I'm going to go through how to heal a disc naturally and just what to know when you're trying to heal a herniated disc, a degenerative disc, bulging disc, stenosis, whatever term you've been thrown at when you get an MRI or an X-ray. We are going to go over how to heal that. Yes, you can heal a herniated disc. Is 100% of them curable? No, nothing's really at 100%. But in my office, herniated discs, when someone goes through my protocol, my program, it's about a 95% success rate in my office. So I'm going to teach you today how to think about the stages of healing your herniated disc. Starting at day 1 to 2 weeks, we'll say, is the acute stage where there's a lot of inflammation and a lot of pain. Now, everyone's is different. You can have severity of pain being a 10 out of 10 and disabled to a 2 to 3 out of 10. So it ranges wildly, but most of the most pain and inflammation is going to be in these first 2 to 3 weeks. And this is where people start to go look for pain management of their spinal disc, depending on how severe it is. If it's very severe, patients will likely go look for a cortisone shot. If you go to a primary care, they might give you muscle relaxants, pain pills, and an anti-inflammatory, maybe a prednisone pack for 10 days, sort of thing. The thing to be concerned about if your pain is very severe is you only want to get 3 cortisone shots in one area of your body. Some say per year. I've heard in your lifetime in that area, because cortisone can soften ligaments, soften cartilage, and even deteriorate bone if you have too much cortisone in an area. So it can lead to long-term side effects. It's definitely a short-term solution for pain, but just keep in mind this stage is just the acute inflamed pain stage, and if that's all you focus on, that's all you did, you would never be fixing the root cause problem of your disc issue in the first place. So to actually heal a disc, you need to go through at least the minimum of the 2-week stage to the 8-week stage, somewhere around there on average. First day through 2 weeks, acute inflammatory stage, and now going into weeks 2 to week 8 is going to be what I call the healing stage. This is where a lot of the healing needs to happen. You need the right environment for a disc to heal. I'm going to break down what a disc is. A spinal disc, right here, let's see if this will focus for us, there we go, is the pad between the bones. That pad, the thickness of that pad, helps make up the nerve hole where the nerve exits. So when you have a disc herniation, you're going to have either extruded disc material coming out. This is when they do spinal surgeries. They'll shave that disc sometimes. Sometimes they'll fuse it, which is even worse. And then the disc here from this view could be internal still. And these fibers, these cartilaginous fibers, are made up of 75 to 85% water, and the remainder of it is going to be collagen and some proteoglycans. You can think of collagen and proteoglycans as the fibrous tissue that supports and gives structure, kind of like a brick and mortar. You have the bricks as the solid amount, and then between the bricks you have the mortar that keeps everything together. You got to think of collagen like that fibrous connective tissue that holds everything together. That's what gives your spinal disc stability, and the water, 75-85% of the water hydration, is what gives your disc that buoyancy, that cushion, and that space for that nerve. Notice when the disc is degenerate, you have that nerve hole is so much smaller, and that's what they call spinal stenosis. When that nerve hole gets smaller, that's spinal stenosis, and that of course can lead to sciatica down the leg, cervical radiculopathy down the arm. Even those nerves go to organs and glands that can start to affect a lot of function in your body. So this weeks 2 to 8 is critical to setting the stage for proper healing. We'll get into more what you have to do to get that to happen, but This stage, last thing I'll point out, can take up to 6 months. Of course, severity of disc injuries vary drastically based on age, based on how bad the disc is injured. Of course, if it's ruptured, that's a medical emergency if it's gotten to that point. But we're going to stick to the healable forms of disc injuries today. And if you had a bone break, like a spondylolisthesis, that bone now needs to heal. And so there's different variations, but on average, 2 to 8 weeks with proper treatments is the normal healing stage. From weeks 8 to 16, we're going to get into what I call the stabilization stage. This is where we're going to focus primarily on restoring function and movement, so you can use your body the way you need to move it. So many times flare-ups can happen in this stage. It can happen at any time, but this stage is very common because patients are feeling better, they want to move, it's been 8 weeks, they want to get back to the sport or whatever they want to do with their body. Maybe in the summertime you're wanting to get into gardening, do your yard work, do life stuff, the things you want to enjoy for quality of life. And this is where maybe the disc isn't fully healed or it's on its way, but you haven't got stability of the tissues themselves, the disc tissue, the other joints around it that might have compensated from this whole journey. And this is the time you don't want to back off. You want to keep doing the things you're doing to heal it, and you want to focus on certain smart spinal disc rehab exercises. I don't have enough time to get into the details of those exercises, but look for other videos where I go into those in more depth, at least some baby steps to steer you in the right direction. These types of exercises a lot of times need to be very specific to the patient I'm working with. Everyone is so different. I like to say that everyone's body is as unique as our fingerprint. Not everything is the same for everyone. Not every treatment plan is the same for everyone. Everyone is uniquely different, and as I help them heal, we take a unique approach for literally everybody that we work with. And the exercises are no different, and movement. Beyond 16 weeks, now these are average time frames, so the 8 to 16 week is the stabilization stage. Beyond the 16 weeks, we're going to look at management. Just call it the management stage. This is a long-term approach to having healthy spinal discs and preventing relapse from happening. I will tell you, relapses suck. Patients hate them. Sometimes relapses are so bad we have to start back on day 1 in the inflammatory acute stage and work our way back through the healing. It's a journey every time someone's injured or relapses. It's time, it's effort, and we really want to prevent you from this happening again. We want to fix your disc, and hopefully you maintain it and manage it well enough that it never happens again in your lifetime. In this stage, the long-term management includes, I'll go through 4 things you should be doing to maintain and manage. These 4 things are part of each of the beginning stages as we work through. They're just going to look different as you get to management. They'll probably be less intense, less frequent and aggressive of treatments. But here's number 1. We are going to continue to make sure your spine is aligned properly and the motion in the disc and the joint is good. What does that mean? Almost every patient that comes in with a disc issue has some form of a misalignment of their spine or commonly their pelvis, and that's the root issue that set them up for failure to begin with. So with Gonstead Chiropractic Care, we're focusing on restoring the alignment and the motion specifically to the spinal disc, making sure anything affecting that disc is removed and we're clearing that out as best we can. In the management phase, we want to continue to do that because life keeps going on. You're going to keep moving. You're going to move more normally. Hopefully you're moving a lot. And this just happens. It's like eating and getting food stuck in your teeth. It's inevitable. It's going to happen. You have perfect teeth. It's going to happen. Same with your spine. Little misalignments happen regularly, and they're not a big deal. Just have them looked at, have them checked, and cleared out as frequent as you're able. That might look like once a week. It might look like once a month, or somewhere in between there. But some form of spinal alignment management and adjustments. Number 2, we're going to look at spinal disc decompression. This is a whole nother seminar, but I'll try to explain spinal decompression here. The disc itself, you can think of when someone has a disc bulge. I'll show you, this is a normal healthy one with no bulges here around the disc. Disc fiber is nice and healthy and thick, stable as can be. When you have a disc bulge or a herniation, it's going to tear through the fibers. You're going to damage the fibers from degenerative disc disease. And any bulge happening to the disc, we want to get that to return back in. With spinal disc decompression, we're creating a negative pressure to the spine mechanically and non-surgically. That negative pressure you can think of like a vacuum, or like if you let go of a sponge and the water comes back in. You can think of that, it's drawing that disc material back in. Remember, 75 to 85% is water. The remainder is collagen and cartilage nutrients, type 2 collagen and several others, with a little bit of proteoglycan. So that leads into the third stage of healing and management of spinal discs. You need enough collagen in your diet. You need to eat enough collagen or supplement enough collagen on a daily basis. Collagen is an ancient nutrient that we got enough of through eating organs and glands, skin of chicken and fish, bone broth. We got a lot of it in the past. Today, most of my patients don't get enough of it, maybe not even any of it, daily or weekly or monthly. So we rely heavily a lot on collagen as a supplement, either in a glandular form or a powdered form through certain collagen peptides. In the beginning, I heavily recommend 3 times a day collagen in your diet or supplement it. As you get into this management phase at 16 weeks and beyond, you can continue to do collagen at 3 times a day to make sure you're sufficient, or you can dial it back and do it once or twice a day. But at the end of the day, all of us need collagen daily, especially if you want healthy joints and healthy spinal discs. The fourth thing for management is movement, specifically movements that the spinal discs like and help keep them hydrated and healthy movement. We incorporate all of these throughout each of the stages, just strategically in certain ways. Think of kind of like a Rubik's Cube. There's a certain way you need to do this. And so some of this you can do on your own. A lot of it you can do on your own. I wrote a guidebook on spinal disc rehab. I give it to all my patients. A lot of this is what you can do at home and how to do it at home to make sure you're healing your disc properly. I hope this video is helpful for you. I know I didn't cover everything. I'll probably have to do more videos to describe things in more details. If you have any questions, anything I missed that you want me to cover, make sure to write it in the comments or reach out to me. I want to dive deeper into spinal discs and how I've treated them the last 15 years and how we heal spinal discs in our office at a 95+% success rate. So reach out. Hope this video is helpful for you. See you soon.